Alternative medicine is any type of medical therapy not regarded as orthodox by the medical community. Some examples of alternative medicine are homeopathy, chiropractics, herbalism, and acupuncture. An increasing number of people are turning to alternative forms of medicine to reduce stress, relieve chronic pain, and treat other ailments. According to 2 studies from the National Institutes of Health, nearly 1 out of 3 people in the United States are seeking alternative forms of medicine. Many medical professionals prefer conventional medicine over alternatives due to the rigorous testing conventional medicine has to go through in order to be approved by the Food and Drug Administration. This allows doctors the use of such medicine to cure or reduce a patient's symptoms. One concern among the medical community is that these alternative treatments are only a placebo effect, and since the patient believes in the medicine, it ends up working for them. Doctors are worried that testimonies in favor of unproven medicine will cause other patients to use the treatment.
A placebo effect's just as good in some things. It doesn't matter if you have placebo effect or if it's really doing something different.
Although a placebo isn't necessarily bad, it doesn't help everyone. Those who the placebo doesn't work on will have wasted time on a treatment that hasn't helped them at all, and being left untreated might only exacerbate their condition. Another argument against the use of alternative treatments is the concern that patients will begin to turn away from their doctor's advice. This is dangerous for the patient because there are many misconceptions and lies about medicine on the internet, which is where people typically go for fast and easy medical advice. Tabitha Grant, a nurse at Owensboro Regional Hospital, says that this is not the case. According to her, it is the opposite. Typically, patients try to heal themselves first, usually from colds or sore throats. If their own remedies don't work, they will come to a physician for advice.
People are distrustful of the medical community and they just see so much, they're bombarded with so much on the news that they're not sure what to believe. They think pharmacies are pushing medications, that they're just trying to make money. And you don't get the same kind of time that you know, years ago when, our parents and grandparents were being treated by their physicians. You just don't see them very long. If that patient and physician or even nursing relationships not developed, there's just not a lot of trust there.
One solution, according to Nurse Grant, is for doctors to try and understand and accommodate patients' beliefs when treating them. Quote, doctors are just going to have to allow that their patients have different views than them and how they want their treatment to go. The real problem with alternative medicine stems from a lack of trust between doctors and patients. The setting at a doctor's office is a lot different than it was even 10 years ago. Today, the average amount of time you actually spend talking to your physician is about 13 to 16 minutes. Some people believe that doctors do not spend enough time examining their patients and that they diagnose too quickly. This is the cause of mistrust between patients and doctors and why so many